How do you think Ayurveda talks about optimizing the delivery of these therapeutic agents? Maybe you already kind of said a bit, but I wanted to discuss a little bit more on that as well.
Yeah, delivery of the therapeutic agents, I think we need to discuss the concept of anupana that we just touched upon. There are two concepts basically. One is like purification process or Shodhana, and then the specific mediums that we spoke about, like ghee, honey, or takra. I think just to sum it up. So these agents, like proper purification of, let's say if you're using metals, I mean, that is where the Shodhana concept comes. But not a lot of herbs require purification as such. But the medium in which we are giving the medicine is really, really important. And that medium is also discussed at length. There are separate chapters on the same. And after every formulation that is discussed in Ayurveda, our acharyas have told as to with what we should give that formulation and what works the best. So at the end, after the indications, it is always told that give this with ghee or give this with takra or give this with pomegranate juice and different options. So I think as long as we stick to this classical information of giving a certain formulation with a certain anupana, I think that itself is enough to ensure that the herb is properly absorbed into the system.
Yeah. And I mean also how it influences the PK, the pharmacokinetics, right? The amount of drug in the bloodstream, for example, if we are talking orally, reaches into the bloodstream, is of course influenced by the absorption, right? So, and then the right anupana or the right vehicle will get that amount into the bloodstream. So that's where I was it's like how they had figured it out, like when you were talking about the vata person and the pitta person, and then giving them a certain vehicle, the certain dosage of the herb, so to reach the same therapeutic window, right? I mean, we are talking about how much that PK, while in kapha person, you may give the same herb, but in a different dosage with a different anupana, but still thinking about the PK or the efficacious dose that they should be reaching in their bloodstream. So that's, I think, the role of the vehicle changes with the dosha
Correct.
of the person. So
Yeah.
that's it's very fascinating. I know, like, we can talk a lot about this, and maybe we should do a podcast on just anupanas, maybe taking one herb as an example, say turmeric, which is, and then different with different doshic people, and how different vehicles are used as a strategy to get that the Cmax or the amount of herb in the patient, right? So it's something that we should probably go through in another podcast. But today we are limited by the time.
I know. I just wanted to add one more point to what you just said. I think we have discussed rasa, we have discussed virya, vipaka, and prabhava concepts. But the very important concept is the concept of guna or attributes. Attributes of the herbs, what they can do within the body. So the concept of guna itself is very huge, and it is very influential in disease management. So I think this is something that we can touch upon in the next podcast. This is also a crucial form of pharmacodynamics and kinetics. But yeah, we'll discuss this further.
Yeah. I mean, it will be nice to, I don't know if there is any data available, but in terms of like Tmax and Cmax, because that's what you were talking about when you said about the vata, pitta, and the kapha person. And you were talking about, like, you can see the side effects quickly, but you can also see the benefit quickly in a vata person or a pitta person versus, but because of because vata due to mobility, pitta because of their metabolic fire, but kapha person may be a little bit different. So how intriguing this is, right? I mean, it's just so many layers and so much depth, and if you put the modern like the pharmacokinetic principles on it, and I mean, my mind is working overtime right now, but I'm just thinking, like, where is the Cmax probably? What is the Tmax? How soon are they reaching the Cmax, like the maximum concentration? And how do we adjust the dose? And am I doing that or not? Is also something that I was thinking in our patients. So it's very fascinating. the whole thing. And then I feel the integration of these ancient wisdom would be really, really worthwhile. And it is clear that Ayurveda's approach to bioavailability was holistic and very detailed also. And I think that these formulations were created with some very specific techniques to enhance the bioavailability, like the anupanas and all that we just discussed, and the efficacy of these therapeutic agents. And like I said, we should think about maybe down the road of a particular herb, but these herbs are processed through probably various methods. And like you already talked about it already. And then, of course, we talked about anupana and how, like, right, it could be water, milk, honey. And I think all that is something that can be, that needs a deeper discussion another day, I feel. And so I also am always intrigued by the lifestyle practices that Ayurveda emphasizes, right? The regular daily routines, mindfulness, relaxation, exercise, in addition to all that we just discussed for promoting overall health and all that stuff, vitality, resilience, all that. And I think an Ayurvedic practitioner when they prescribe these agents at that specific dosage, specific times, it's all about optimizing that delivery and effectiveness that I think we already kind of discussed. And these recommendations, like you already said, the diet, depending on the severity of the vikruti or the condition. And then you also match that to the potency of the herb and all that, herb and the formulation as well, I think. I know you also spoke about Panchakarma, right, which is used to remove toxins and impurities a bit. So I know that it is the stronghold of Ayurveda, and it's done. But also I know that we also include yoga, meditation, all that as well in all that. So how do you think about like all this inclusion of all these other practices along with the herbs? How does it influence the pharmacokinetics, in your opinion?
No, I think absolutely when we say Ayurveda is holistic, we are talking about not just medicinal treatments or herbal treatments. It is not about listing down the symptoms and giving the herb according to every symptom. That's not how it is. Integration of all of these practices. It is a harmonious tango between ancient knowledge and modern understanding. I think all of this are, a simple breath work can actually help in better absorption of the herb. When we are breathing deeply, when we are shifting from a sympathetic to relaxed parasympathetic phase, we are actually helping with better absorption of the herbal formulations and the diet also, because the gut is also calmer. It is enhanced in its efficacy to absorb certain things. So all of these factors are important, and that's why patient compliance is the key here. We talk about diet changes, lifestyle changes, herbs, and a lot of other things. Implementing them at every level will definitely ensure that we are not just talking about symptom management, but we are talking about reversal of the disease pathology. And all of these factors are very, very crucial to reverse the disease pathology.
We all see a lot of patients, clients who come in with stress.
Yeah.
Right. And that's what you were trying to say, is having to manage that stress is also important for an efficient absorption or efficacy and excretion, all of that pharmacokinetic principles, right? When you're giving that person with to manage their other symptoms. So I feel overall how Ayurveda employs a holistic approach to optimize delivery of these therapeutic agents is like totally fascinating and intriguing. How it takes into account various factors such as formulation, diet, lifestyle, dosage, timing, combination therapies, detox therapies, and all these mind-body practices. I know that's why it is very, very complex when you start studying Ayurveda. It is a lot of layers of thinking, and how Ayurvedic practitioner spends hours when a patient walks in or a client walks in to get them the right kind of recommendations or treatment strategies, right? because you have to look at the individual's unique needs, you have to look at the imbalances, and then give all these therapeutic recommendations, right? So it's highly complex, I feel. So thank you, Dr. Aditi, again. This was a very detailed topic, and I think both of us still feel that we didn't cover every
Yeah.
single thing that,
Yeah.
or I mean, it's just a beginning. We'll be doing a lot more of these, maybe a smaller topics with more detail as
Yeah,
we go
that's the way
along.
to.
But it was still a very intriguing topic, and I really appreciate your presence today and describing a lot of things in great detail. And everybody, thanks for listening, and stay tuned for our next podcast on a similarly captivating topic. And remember to subscribe to our YouTube channels. Please share your feedbacks and in our comment section. And till our next podcast, thank you. We will share our YouTube channel addresses and stuff in our comment section as well. Thank you, everyone.
Thank
Thank
you,
you, Dr.
Dr.
Aditi.